Hi, my name is Navin Verghese. I'm a Consultant Spinal Surgeon. I work in Sancta Maria Hospital. I deal with all aspects of adult spinal surgery, from the more routine pathologies and procedures through to complex and minimally invasive spinal surgeries. Cervical spinal surgery, on the whole, is performed for three different problems, which are all interrelated. Brachyalgia is severe pain down your arm due to a trapped nerve in the neck, due to a bulging disc or a bony spur, for example. Most of those do settle on their own, or with the help of physio and injections. However, for those 10% where it doesn't, cervical spinal surgery can significantly take the pressure off the nerve and therefore significantly improve pain and function in the arm. When it becomes more serious, however, for example, if there's elements of nerve damage, weakness or numbness in the arm, then your surgeon may recommend escalating directly to surgery, bypassing the aforementioned physio and injection therapies. The essence being to prevent permanent nerve damage. And the most serious condition, myelopathy, that's where you have bony spurs and discs pressing on the spinal cord. That is a serious condition which you must seek a general practitioner help for and urgent referral to a surgeon. This generally manifests with clumsiness in your hands, loss of function. Patients may feel that they are losing their handwriting or dexterity, and in more serious forms it can then also result in loss of gait function, i.e. problems with your walking, to the extent that in severe cases some patients may end up wheelchair bound. There are alternatives. 90% of brachyalgia, for example, and painful conditions down the arm can spontaneously resolve. Sometimes with the help of a general practitioner, pain medications, sometimes a spinal injection, which we can organise as well. However, for those patients, 10% who fail at those measures, surgery can provide a very useful solution. There are a number of different operations which you can have on the cervical spine for these painful and debilitating conditions. The most standard procedure is what we term an anterior cervical discectomy infusion, or an Acdf. This is an operation through the front of the neck which involves removing the disc and the bone spurs pressing on the nerve or the spinal cord and replacing them with a cage with some bone graft placed in between. There are other alternatives such as a disc replacement, which preserves your motion and therefore can have specific benefits for specific sets of patients, and in those patients with very serious spinal cord compression you may need a posterior operation or a laminectomy. This is from the back of the neck. Following Acdf surgery, which is the most standard procedure for this type of problem, you may experience some neck pain, occasionally some pain in the arm. That's normally very well tolerated with simple painkillers, and you'll be prescribed these to go home. Most patients go home the next day. You will also have, however, some swelling around the throat area, which can cause some swallowing issues, and your surgeon may advise you to step down in terms of the types of food you eat. For example, soups, lukewarm foods, cold fluids, baguettes and very hard stuffs ill-advisable, at least for the first 7 days. Most patients are back to work by 6 weeks. Some patients with more manual jobs phase back over the course of 3 months. Aside from the general risks of surgery, which are much the same for spinal surgery as with all other types, such as anaesthetic risks, blood clots, infection, there are more specific risks. In particular, from the surgical approach, one can have more sustained swallowing issues which could last a few weeks. This can usually be very well managed with the type of food you eat. Some patients do notice a hoarse voice. Again, this can last a few days up to a few weeks